Hi, my name is Aaron Bodette, and I've been helping Medicare beneficiaries for about 29 years now. And I put together this clip to explain to you some of the important components of Medicare, how Part A works, how Part B works, what they cover, what they don't as far as co-pays and co-insurance. And this is a good, brief 500-foot view. Um, After you watch this, you're really going to have a much better understanding of how it works. I know this because my clients tell me over and over. I have never had it explained quite like this before, so this has been very helpful. And whether you're on Medicare, deep into Medicare years, you're new to Medicare, I know you get a lot of mail throughout the year, especially during the fall and annual enrollment period. So I'm going to help you make sense of all the mail. Um, I'm available by phone if you need me. Reach me. My contact information will show up here. Email, message me, what have you. And I'm an independent agent. I represent a lot of different companies because there's a lot of different needs. There's no one plan or company that's perfect for everybody. So that's kind of important to know. And I can help guide you, educate you, so you can make a decision on your own with or without me. But if you want to use me, you're welcome to call me or reach out to me. I'm paid by insurance companies. I'm not paid by you. It doesn't cost anything to talk to me. Okay, let's start here. When you go on to Medicare, there are two options, option one or option two. Option one is you can stay on original Medicare where you have Medicare Part A and Medicare Part B. And you can choose to add a Part D drug plan if you'd like, and a Medicare Supplement or a Medigap insurance policy. I am going to describe this to you in detail in a few minutes. Option two is Medicare Part C or Medicare Advantage, where you still have Medicare Part A and Part B. Many times they add Part D together. It's kind of a buffet and not individual. There's no best solution. This is why there's so many solutions on the market. Everybody has a different need, and that's exactly why there are so many companies and so many plans on the market. But as I said, we're going to talk about this side first because this is how you'll learn how Medicare works. In the supplemental world, there are many different plans, A through N with a few that are missing. And, they all have a different variety of things that are covered. I'm going to go through Plan F right now because this is the best way, as I say, to learn how Medicare works. So right now we're going to look at Plan F. All right. There's many plans. I'm going to go over a few of them and help you decipher how it works. First, we're going to talk about Medicare Part A. This is the hospital portion of Medicare. This is the semi-private room and board, nursing and miscellaneous services and supplies. This is not, a television and private room and all those things, but this is what you really need. Medicare Part A has no cost, providing you are fully vested in the Social Security system. If you're not, you can still get it, but there is a cost associated with it. All of this information is available on the Medicare.gov website, and it's a very deep website. But I'm going to make this very simple. If you go into the hospital for a day or 2 days or 7 days, anywhere less than 60 days, Medicare will pay the whole hospital bill except for $1,364. They call this the first day deductible or the Part A deductible. Plan F pays that deductible for you, so you actually don't pay anything. If you come out of the hospital for 60 days and re-enter the hospital, you will probably have to pay this again. It could be paid several times in the year if you were unfortunate enough to come out and go back into the hospital at specific intervals. But this is one reason that somebody would, want to carry coverage beyond just Medicare. These plans were set up in the 60s upon inception of Medicare, and they really haven't changed much except for the figures. The configuration hasn't changed. In the unlikely event you're in the hospital between days 60 and 90 or 61 and 90, Medicare will pay everything except for $341 per day. All right, this is over $10,000. This is a big number. Plan F would pay that for you, so you wouldn't have to pay anything. Again, this is why people carry additional coverage. In an extremely rare circumstance, you're in the hospital more than 90 days, from days 91 up to days 150, Medicare gives you 60 lifetime reserve days. You can use them once during your life. And if you use those 60 days, Medicare pays the hospital bill everything except for $682 per day. Okay, this is over $40,000. This is a really big number in my book. This plan pays that you wouldn't pay anything. After this 150 days is used up, Medicare stops paying. But this Plan F and will pay 100% for one more year in the hospital. So you essentially would have 1 year plus 150 days in the hospital at no cost to you. After that, you would be on the hook for all costs. Generally speaking, they get you out of the hospital quickly, and they put you into what they call skilled nursing care. This is therapy. It's rehabilitation. You've broken a hip or had a stroke and need to learn how to walk or talk again. If you meet Medicare's criteria, meaning you've been in the hospital for 3 days and you entered the approved facility within 30 days, Medicare will cover the first 20 days at all approved amounts, so there's nothing to pay. From days 21 to days 100, Medicare pays all except for $170.50 per day. Plan F pays this $170.50 a day, so you don't pay anything. After that, days 101 and later, Medicare won't pay for this, nor will Plan F, because Medicare won't pay. This is beyond the scope of what Medicare covers. These are different policies, and there's different insurance you can get for that, but it is not with original Medicare. These numbers that I've just described to you generally change every year. There's not a year that they haven't changed in my experience with 29 years. They go up a little bit every year. These policies automatically go up to adjust, so your column here remains the same. I hope you're with me so far. If you're not, send me a message. I will help you any way I can. When it comes to blood, this is covered on Plan F. Hospice care, excuse me, you can see the 0 here as well. That is how Medicare Part A works. This is how Plan F works. Very little exposure, in my opinion, for things that Medicare will cover. Here is how Part B works. We're still on Plan F, but we're talking about Medicare Part B. Most people pay $135 and change a month for this right now for 2019. You may pay less, you may pay more, depending upon income and when you entered the system. But be aware, Part B, this covers a lot of services. This is inpatient or outpatient treatment. This is doctors, physicians. It's specialists, it's surgeons. It's surgical services, supplies, therapy, diagnostic tests, DME, a lot of things. Part B, drugs. And, some drugs fall under Part B if they're administered in a hospital setting or in a clinic or doctor's office. There are many things covered under Part B. Be aware that the first $185 of Medicare-approved amounts, services for the year, Medicare doesn't pay. Plan F actually pays this for you, so you wouldn't pay anything. Beyond that, Medicare generally pays 80% of what they approve. In this Plan F, pays the other 20%. So there's nothing to pay beyond what Medicare approves, providing your doctor will take assignment. As an aside note here, you should be aware that on these Medicare supplements, when you have original Medicare, there are no networks. You're going to go to any doctor that takes Medicare. If they take Medicare, they're going to take these plans. That's how it works. There's no networks. There are some doctors, very few, that won't take Medicare. They won't deal with insurance at all, but most will. So just be aware of that. In rare circumstances that I have not seen in 20 years, there are what they call excess charges. These are charges above what Medicare approves, which Medicare doesn't recognize. This plan pays 100% of them. But to my knowledge, it is limited to between 5 and 15 or 20%, and they've got this under control. Either way, this plan pays 100% of whatever that is. If it's 15 or 10%, again, it's really rare. You won't see this very often. The 0 column is what's important here. If you're getting blood under Part B, as you can see, it's a 0 column because, the deductible is covered, the 20% is covered. For what home health care Medicare covers, you'll pay nothing. They pay 100%. Durable medical equipment, you'll have 100% coverage. Foreign travel, you do have a deductible of $250, and you're responsible for 20%. Plan F pays 80% to a maximum of $50,000. So again, this was a quick explanation. If you have questions, shoot me a message, an email. You can contact me. But this is a really good way to understand how Medicare works. If you haven't noticed, these supplemental plans do not cover drugs. If you want drug coverage, which is suggested, then we go to a different plan and add it to this, a Part D drug plan. And the way we locate those is in another video that I've already put up. I'm going to put up another video about how to find a suitable Part D drug plan based on the drugs that you take. So again, if you have questions, shoot me a message. I'll go over this with you, but you can see there is some exposure, especially the 20%, because this is an infinite number. We don't know what that would be. This is why people carry coverage. Plan F is strong coverage, in my opinion, with all those zeros. It costs more than the alternatives, in my opinion, and the cost fluctuate based on your zip code and where, obviously where you live. In some states, these are medically underwritten at certain times. If you're getting in when you're first eligible for Medicare, then there are no health questions. In New York State, there are no health questions on these plans. You can get in at pretty much any time, and there are no. Okay, I just want to recap a few of the things that we talked about. I want to go back to this chart with the supplemental plans that are available on the market. When we went over this plan, we talked about all these items. The first day in the hospital, what they call the Part A deductible, the $1,364. When you go to this chart, any plan that covers the Part A deductible is covering that. K&L are covering a percentage, as is M, but most of them are covering the deductible in full. When we look at these benefits, days 61 through 90, 90 through 150 on the lifetime reserve days, and the additional 365 days in the hospital, in addition to the 20% on the Part B of what Medicare approves, those are what they call the basic benefits. And all the plans cover all or a portion of those, K, L, and they cover, portion of these things. M is a portion, but most of these plans, again, I like the Plan F. I also like the Plan N. They're covering them 100%. N has a small co-payment. In addition to that, something else that you should be aware of is this skilled nursing facility co-insurance. Again, many plans cover it 100%, some cover a percentage, but this is entailing this benefit here, the $170.50 a day between days 21 and 100 in a skilled nursing facility. So if you look at this chart, the Part A deductible is what that is referring to. The Part B deductible, you're going to get that on Plan C and Plan F. This is the deductible of $185 on the Part B that of the Medicare approved amounts that Medicare does not pay. Plan F and Plan C cover that. We call that a first dollar pay policy. At least that's what I call it. In addition to that, the excess charges, these are rare these days, but these are charges above what Medicare approves. Plan F and Plan C will cover that. Excuse me, Plan F and Plan G I meant. And these are rare these days. If your doctor participates with Medicare or if he accepts assignment, this is not an issue. I don't see that much. Foreign travel covered under some plans. K&L have an out-of-pocket maximum because they're just structured differently. But this gives you an understanding of this chart and what you should consider. Of course, premium is also a consideration. As I said before, they vary by zip code. You'd have to call me or reach out to me, and I have a way of finding, all the options in your area, the lowest premiums, the best ratings, whatever it is, whatever your criteria is for finding a plan. So again, if I can help, reach out. Thank you.